my pleasure to have Bruce Bloom, who I've known for a very long time, nutritionist, healthcare professional, healthcare coach extraordinaire. My name is Phil Altman. I am one of the pharmacists here at Healthy Choice Compounding Pharmacy. And we've been compounding since 1997. Approximately 5 years ago, we went from a traditional retail type establishment to focus in on what our real passion is, which was compounding and helping patients. We built out a state-of-the-art USP 800 compounding facility, and we really feel that with genetic testing and personalized medicine, you're not going to fit a round peg in a square hole. And that's what people are looking for. With a lot of autoimmune issues going on, people can't tolerate dyes, fragrances, and all these other types of situations that their current medications are made with. And we're really dedicated to what we do, and this is what drives us. We're here to educate the patients, because the more the patient understands and the process, the medication, and expected results, the more effective their therapy is going to be. And it's really about creating for that individual patient. We love having those difficult patients. We had a young child just a week or so ago where we had to make a medication into a gummy bear, and we ended up making it into a chocolate syrup gummy bear just to fit them. So that's the fun part of our job, never being stagnant, always learning and transferring our education to our patients. Some of the ways that we do this is we do a lot of women's health, bioidentical hormone replacement therapy, andropause. You know, men go through this just as women do. It's that grouchy old men syndrome. And I think people are just being turned onto it now. A lot of thyroid replacement therapy, autoimmune issues with low dose naltrexone, pain management, dermatology. And some of the ways we help patients is different dosage forms. Do they need a nasal spray, a suppository? Talking about that, a young person who we had to make a lithium into a gummy bear for. That's what we can help patients with. And this is how you can get a hold of us. This is our facility. And really, one of the things that we've started to do since COVID has hit, because we can't reach out and touch anybody anymore, we've decided to come up with these educational Zoom meetings. And tonight, I'm here to introduce Dr. Bruce Bloom, who I've known for many, many years. He's a better basketball player, I think, than he is a integrative physician, but that's a story for a different day. Bruce has been a leader in the functional medicine movement for over 40 years. He has created a practice built on principles and the latest science and research to help assist his patients in improving health outcomes. He is certified by the Institute for Functional Medicine and has taught anatomy and physiology at the college level. This combination gives him a unique skill set and perspective in investigating the variety of insults to the human body and the best solutions on how to repair them. On a personal note, he is a husband, father, and just recently a grandfather who loves and values his family and friends. They are the driving force behind this quest to stay healthy for as long as possible. And I can attest to all those things about Bruce, as I've known him for a very long time. He's a pioneer in this field. We were just discussing that on the amount of time that we've both been doing this. And he still continues to create and educate. So Bruce, I'll turn it over to you.
Well, that's a hell of an introduction. Thank you so much. I really appreciate that.
That's because you wrote it.
Well, there you go. That's why I appreciate it. And you read it almost word for word.
Yeah, almost. You know, have to improvise a little bit.
What Phil Altman has failed to mention about himself is not only is he a legendary compounding pharmacist, but he also sets the meanest pick of anybody I've ever played basketball with. It's easier to go through a wall than to go through Phil Altman. So
that's because I practice Bruce's functional medicine, taking care of my body.
There you go. So you can hit the first slide, Corinne. So one of the things I always get confused about when I talk to people, this is, 2021, and when people ask me what I do for a living and I say I practice functional medicine, I get these really kind of strange looks as if I've said something so foreign. And I don't really personally understand why functional medicine isn't more prominent and more of a household name and recognition. So I usually start by trying to define what really functional medicine is. And so basically, you know, functional medicine is when you step off a cliff, you start heading in a direction, and you can hit the next slide. So, and this is where you end up. So functional medicine is really the place between the first part and the second person here. Somewhere in between that, your system hasn't crashed and burned, and there's still an opportunity for, and a chance for reversing direction and for recovery. So one of the challenges that we have, you can get the next slide too, if you don't mind, is the human body is, you know, is not a gas tank that's just one day full and the next day empty. As a matter of fact, can you imagine if your gas tank was really set that way, where it's just full and then empty, and you would never know if and when you're running out of gas? So functional medicine is the area of medicine that's actually measuring function and trying to intervene before you're at empty. You know, we have a medical model that's really quite amazing when you think about it, in terms of being able to fix things that are broken and replace things that are no longer working. I was at a conference not that long ago, and somebody had a very funny line, said, you know, the dumbest kidney is smarter than the smartest dialysis unit, so keep your dumb kidneys. So, you know, the goal of functional medicine is to really assist in keeping the systems of your body functioning as best as they can for as long as they can, you know, understanding one day they're not going to. But, you know, if you think of life as a game, and, you know, the starting point was your at birth and the ending point is at your death, well, you know, the goal of this game is to try to be the last one to cross the finish line. You don't want to get there first. So that's basically functional medicine. You can hit the next slide if you don't mind. So one of my pet peeves in the healthcare system is when you start to use the evidence of the problem as if it's the problem. Right? So if somebody came in with a bump on your head, you're not going to argue that they have a bump on their head. They have a bump on your head. But I am going to argue that the bump isn't your problem. The bump is your body's way of telling you that there is a problem. Something must have clunked you on the head for your system to react that way. And very often in our healthcare system, we treat the evidence of the problem as if it's the problem. So if you have fever, chills, malaise, and a headache, that's not really your problem. It may be the infection that's causing it. If you have acid reflux, that's not really your problem. It's the reason why your stomach is throwing the acid up. If you have inflammation, inflammation's not your problem. It's the reason why you're inflamed that's your problem. And so we often treat the evidence of the problem as the problem. And it's really easy to do. It's really easy to stop your body from telling you it's not happy with the way you're treating it. As Phil mentioned, you know, I play basketball. I used to. And one of the things I observed from some of the people that I played with, these younger players, was before they played, they'd load up on Advil or Tylenol. And after they played, they'd load up on Advil and Tylenol. And what that would do is not let them experience the pain or injuries they were creating to their body until one day they bent over and all of a sudden a disc herniated or a Achilles tore or a ligament tore. So, you know, we live in a culture where it's just too easy to not feel the discomfort and understand that again, the evidence of the problem isn't the problem. You can do the next slide. So I don't know if you've ever seen this video, but I doubt it's going to work, but this is sort of, you know, what I've learned after 40 years of studying the human condition. And in this video, it's really from an I Love Lucy episode, and it shows an assembly line, and there are chocolates coming down the assembly line, and they're coming at a very slow rate. And at the rate they're coming, you're able to take it and package it and put it away. But then they speed up the assembly line, and all of a sudden, they're having a hard time putting things away. Well, it's very similar to how the human body works. If you can control what comes into the body and your body can effectively manage it and put it away or use it properly, then there's no harm, no foul. But if things come in at a faster pace than your body can actually manage or protect itself against, then that's when bad things start to happen. So you can hit the next slide too. So, life is really a tug of war. It's a balance. You're trying to, the human body, when I taught anatomy and physiology, one of the things that really stood out was the human body is really the greatest example by design of the best offense is a great defense. So the goal of the human body is really simple in concept. It's to try to keep out things that could potentially hurt it and try to bring in things that can help it, or to keep in things that it needs and to keep out things that it doesn't. So if you're trying to get into the human body, it's really not that easy. You have to basically cross a border. And some of the borders that the body has are very difficult to cross. So the most obvious border is your skin. And your skin is a very difficult border to get through. First of all, it's lined with layers and layers of packed dead skin cells, but it also has a gland called your oil glands, which produce a fatty acid, acid being the key word here, which number one keeps your skin from flaking off, but also the acidity creates an environment where bacteria don't really like to grow on your skin because of the acidity. So basically, if you want to get into the body through your skin, then you better call up an insect carrier. You need a mosquito, a tick, a dirty needle, or something that gets through your skin. So technically, the way you really get into the human body is either through your respiratory system or your digestive system. And so these are borders that are trying to protect things from coming in, but they also do allow things in. So your respiratory system is really very prominent in today's world because this coronavirus, that's how it gets in. It doesn't, if it can't get in, it can't hurt you, but it gets in through your respiratory system. So the membrane or the border, the lining of your respiratory system, the healthier that lining is, the harder for this virus to get in. So people who have chronic sinus infections, people who have damage to the lining of their respiratory systems, when they get exposed to the coronavirus, it makes it easier for this virus to get in. And so once it's in, that's a whole other story. So the goal then again of your respiratory system as a system is to try to protect itself and filter out things that can hurt it and bring in things that could help it. That's why, if you're looking at risk factors for dying from the coronavirus, being a smoker is a very high risk factor because of the damage it causes to the membrane or this border that protects you from the outside world. So but the most obvious place and the obvious way to get into the human body is actually through your digestive system. Your digestive system, if you actually took the surface area of your digestive tract and spread it out, it would be about the size of a tennis court. So this is a very, very important border. And part of the reason why it's so important is because it is permeable and it does let things in. But the goal of your digestive system is very clear. When you bring something in from the outside world and you bring it down this tube, the first organ that greets it is your stomach. And your stomach probably has the most important job of your digestive system because its job is to produce a ridiculous amount of hydrochloric acid. And this hydrochloric acid is used to make sure that it kills anything that comes in from the outside world that's not good for it. But it also starts the process of breaking down protein. So if your stomach is not able to produce adequate amounts of hydrochloric acid, then your body becomes vulnerable further downstream. And you're seeing a lot of people who are suffering from things like acid reflux, and we think it's because of an overproduction of hydrochloric acid in your stomach. But quite honestly, that's what your stomach's job is. But the hydrochloric acid that's in your stomach is not supposed to be shot up into your upper stomach and esophagus where it actually can cause damage. So one of the things you look for is you want to make sure that this organ is functioning at optimum levels of efficiency because this is the protector. Hydrochloric acid is what your body uses to protect itself from the outside world, so much so that your body basically says, if you're going to enter any orifice that's open to the outside world in the human body, then we're going to protect ourselves by making this cavity very acidic. It's the reason why, by the way, men have prostate glands. because another opening to the outside world is the vaginal canal, and the vaginal canal, in order to protect a woman's body and internal structures, is ridiculously acidic. And if it wasn't for prostatic fluid, which neutralizes the acidity for that moment to allow sperm cells to survive, then the reproductive process would stop. So shutting down the production of hydrochloric acid in your stomach is really, really very dangerous to the rest of your digestive system. So your digestive system, once you get through your stomach, you enter a part of the digestive tract called your small intestine, which is, kind of very misnamed. It should be called your long intestine. This is the longest part of the tube. It's actually called small because of it's narrow. And here, food that you're eating is going to be, first of all, it's going to be acidified and partially digested in your stomach. But then once it's released into your small intestine, it's going to be greeted by the enzymes of your pancreas and bile from your gallbladder. And the goal is to break things down into a form that your body can use once you cross the lining of your digestive system. When you leave your small intestine, you enter a structure called your large intestine, which is only large because of its diameter. But here you're going to be greeted by this massive population of bacteria. There are more bacteria or microbes living in the lining of your digestive tract than you actually have cells of your own body. Again, at a conference, somebody noted that because of that fact, we can almost argue that we're really a bacteria having a human experience. So the health of that population is very, very important to what happens on the other side, because once you cross that border, you can hit the next slide, I'm sorry. Once you cross that border, where does things go? Once you get into the body, where do you go? Well, if you get into your digestive system, your body's going to have to make sure that whatever gets in is not going to hurt you. So you have to go through a series of filters. And the most obvious filter, the one that we're going to put a lot of attention on tonight, is your immune system. So lining your digestive tract, your body puts approximately 80% of your immune system. Now, why would you put most of your army there? Well, you would put most of your army there because that's probably where things are going to get through. It's a very smart, intelligent system. So you have a large defense system lining your respiratory system, and you have a massive defense system lining your digestive system. So your immune system is really a filter. It's to filter out anything, particles, debris, bacteria, undigested food, anything that could potentially be a strain on the human body. And then behind your digestive system is unique in the sense that every blood vessel that leaves from your digestive tract goes to this other filter called your liver. And your liver is sort of this last entry point before you get into your regular circulatory system. And if you look at the human body and you say, what systems in the human body are probably not designed for the current lifestyle that most of us lead, and it would be your liver, because your liver is on overload. So many people are walking around with damaged digestive systems. They're not digesting things effectively. They're eating things that are not good for the body. As Phil said, there are chemicals, there are additives, there are preservatives, there's antibiotics, there's all these particles and debris that are going through your digestive system, basically stressing your immune system and then stressing your liver on the other side. And there's to the point where I think there was a study that came out a few years ago suggesting that about 60% of all adult Americans have some form of non-alcoholic fatty liver, which is another way of saying that you have a clog and a very big filter in your body. So if you want to help your immune system, if your goal is to help your immune system, then number one, you can hit the next slide, I'm sorry. Number one, how do you protect an immune system from injury? Well, it's very simple. Be really, really careful about what you bring into the human body. Because once you get in, your immune system is going to activate itself. And your immune system is no different than any other system in the human body. Every system in the human body, by the way, has a gas pedal and a brake. Just like your car has a gas pedal and a brake, they're opposites of each other. And if you didn't have a gas pedal and a brake, you wouldn't be able to either start your journey or stop your journey. You'd crash. So the human body, and again, it's not necessarily just your immune system, but every system has an opposite. You have a muscle that does this, you better have a muscle that does that. You have something that raises your blood pressure, you better have something that lowers your blood pressure. So your immune system has a gas pedal and a brake. The gas pedal is its ability to go after things that are not good for it. And the brake is very, very important, because the brake is your body's ability to make sure that it controls that response so you don't crash, right? So when you look at people who are dying from COVID, one of the things that you're seeing is the people who are at highest risk of death from COVID have an immune system that either has a gas pedal and no brake, or a brake and no gas pedal. So what would cause your immune system to be so weakened? Well, again, look at the studies and you say, who are at the greatest risk of dying from COVID? And number one are smokers, and number two are people who are obese. What does that mean physiologically? It means these people are bringing things through these borders that are trying to protect you from the outside world. And now you're being greeted by your immune system, which is a filter, and these filters are just getting beat up. And when they get beat up, they don't work as well, and they can't protect you, and they can't defend you. And so your system starts to, you start to create some secondary problems. In the human body, if you're lucky and your body can't get rid of something, where do you think it goes? Well, if you're lucky, it goes into fat stores. If it goes into a fat cell, then you've protected yourself. But if it doesn't and it circulates, it can start causing damage and injury to all of your major organ systems. It can cause damage to the lining of your arteries, causing cardiovascular problems. It can cause damage to your joints, causing joint osteoarthritis and rheumatoid arthritis. It can actually cause damage to your brain. There was a interesting study on Alzheimer's that basically said that, Alzheimer's is by the time you're diagnosed with Alzheimer's, you're kind of that coyote that I showed you where you've crashed and broken. Your brain has been so damaged, it's damaged beyond repair. And at that point of intervention, there's really nothing that we really can do to make that system work again. Once something is dead, nobody's been able to figure out how to make it undead. So what they found basically is that Alzheimer's is the end of the line of the breakdown of the filters that your body uses to protect your brain from things that can insult and injure it. And to get through into your circulatory system of your brain, you got to cross this last boundary or border called the blood-brain barrier. And this barrier can become compromised, particles and debris get in, and then, the system is just going to be compromised. So again, if you're trying to help the human immune system, be careful what you bring in. And the way you get into the human body predominantly is through your digestive system. So really good, healthy diet. Make sure that your body is breaking things down in the form that your body can use, and you're not eating things that your body can't use. And also you want to make sure that you bring in all the nutrients that your body needs in order to regulate your immune system's response. Every system in your body, just like your plant needs water for it to grow and needs healthy soil, every tissue in your body requires specific nutrients, either vitamins, minerals, or families of phytochemicals that actually help assist its function. And that comes in through your digestive system. So if you're eating the proper diet and you're not bringing in things that your body can't use, and you're bringing in things that your body can use, you're going to reduce a tremendous amount of stress to your immune system and allow your immune system to recover. And you don't want to go into battle with a beat up immune system. So, and this is again what we're learning from this terrible virus that's really affected so many of us. You can hit the next slide. So the challenge that we face when we're dealing in a healthcare system is that we're all different. It's not a one-size-fits-all system. So, there are three variables that determine how your body is going to compete in this environment that you and I live in. And one is that, we'll have to have this terrible conversation, the G word, genetics. Yeah, we are limited by our DNA. And if you don't think you're limited by your DNA, then you're not thinking correctly. So just jump off a 30-story building, and when you hit the ground, you'll realize that your you have limits to your genetic makeup because your body's not going to be happy when it hits the ground. So it turns out that, one of the challenges in the healthcare system, and one of the reasons why Dr. Phil Altman is so brilliant, is because he's smart enough to understand that we're all different and that it's not a one size fits all system. And statistics are wonderful when you're talking about overall population groups, but statistics don't really matter much when you're talking about an individual, because we all have individual genetic variabilities that make us so unique. That's one of the gifts of the human body, and it's one of the reasons why we're able to survive as a species. If we were all genetically the same, then the one virus that killed one of us would probably kill all of us. So nature, in its infinite wisdom, makes us all very different, and sometimes the differences are just unbelievable. Just look at skin color alone. There are people whose skin are very dark and people whose skin is very light. My wife happens to be very light skinned. I'm darker skinned. If I say the word sun to her, she gets red. So it's not her fault that her skin doesn't have the ability to produce a pigment that protects itself from ultraviolet radiation. So, you wouldn't hire her as a professional sunbather in the tropics. So again, we are limited by our DNA, and hopefully as time moves forward, we'll have a better understanding of the uniqueness of our DNA, so we can customize pharmaceuticals, and we can customize food plans, and we can customize nutraceuticals to meet the specific unique needs of that person. You can hit the next slide. So, one of the challenges we face is, again, because we're genetically different, we have to have a healthcare model that focuses on the uniqueness and the individual capabilities of that person. So if you went to an optometrist, you wouldn't just get a statistical pair of glasses based on what, everybody your age and your gender sees. Half the population's nearsighted, half the population's farsighted. So you would get glasses that are custom made to your unique prescription. Well, you want formulas and foods that are custom made to the uniqueness of your digestive system and the uniqueness of your immune system, right? It's very important to do that. Next slide, please. The other variable that you deal with when you're working with people is age. Our bodies work differently at different stages of our life. And, the older you get, when people say I'm getting older, in many ways, what you're really saying is I'm losing function. So there's chronological aging and biological aging. Chronological aging is something you can't control. Tomorrow you're going to be a day older than you are today. But biological aging is really a measurement of function. And you can sustain your body's ability to function at a fairly high level for a lot of years. A lot of people are losing function at earlier and earlier ages. And so if you're treating your body right, you're able to maintain and sustain function well into your 60s, 70s, and even 80s. And then obviously, as you get older, things do start to decline, but you don't want to accelerate that decline. And what accelerates that decline, next slide, please, is the stressors of the environment. You want to age the body, stress it, and the way put it in an environment that's just not friendly to it. It could be excess radiation. It could be gravity pushes you down. It could be bacteria and other microbes. It could be poor food. So the three variables that you have to account for when you're working with people is genetics, their age, and how beat up is their system. Some people come in here and they're 40 years old, but they're functioning like a 60-year-old, or they're 60 years old and functioning like a 40-year-old. So what does it depend on? It depends on how well you've taken care of your system over these years. Again, what COVID has taught us is don't go into battle with a beat up system, because your chances of surviving get less and less as your system becomes weaker and weaker. And you have a lot of control over that. Most people have control over that. And one of the key controls is being careful what you bring in, either through your respiratory system or through your digestive system. You can control that. And so go to the next slide if you don't mind. So when you're dealing in functional medicine and you want to assess function, you know, it's very different. It's a very different technology and test than our standard medical tests. Most of the medical tests, and I'm a huge fan of medicine, but most of the medical tests are measuring failure. So if you're falling from a 30-story building and I'm x-raying you all the way down, your bones look really good. Or if I'm CAT scanning you or MRIing you, your bones look really good. When you hit the ground, your bones don't look so good. And what's surprising is we're surprised. We're surprised that you say, well, just a second ago, this person seemed to be really healthy. What happened? Well, what happened was we asked the first question as they're falling, which is there any evidence of anything broken, dead, or dying, or about to die? And the answer is no. And then you hit the ground and there's the evidence. So what if we asked a different question? What if the next question was, okay, good, nothing's dead, nothing's dying, nothing's broken right now. What if we asked, well, how well is it working? Or are you heading in a direction that would indicate that your system is starting to lose function? And there are ways of testing. And one of the tests that we do in our office it's called body composition analysis. There's a system called RJL systems, or bioelectrical impedance analysis. And it's a great way of measuring. The scale is great at telling you how much you weigh, but it doesn't tell you a breakdown of your weight or what compartments make up your weight. So if we know how much of your body weight is water and muscle and bone and fat, and we can track you over time. And if we see an accumulation of excess fat, if we see an accumulation of excess water, or we actually can measure energy levels, if we see a decline in energy, we can see a body that's saying, hey, I need some help here. And the best time to intervene is while the system still has an opportunity or a chance to recover. You can hit the next slide. Another test that we do, this is actually a very interesting test. It's so underrated and undervalued. It's called heart rate variability testing. So years ago, researchers, again, we're very good at telling you what's not working. We're not very good at telling you how well things are working or how stressed is your body. So if you really want to answer that question, researchers found that you want to talk to this part of your brain that you really have no conscious control over, that controls all of your basic functions, including your stress levels. And that part of your brain is called your autonomic nervous system. And as we said, like every system in your body, which has a gas pedal and a brake, your autonomic nervous system has a gas pedal and a brake. It has the sympathetic division, which activates you when your body thinks it's being chased by a tiger. And it has the parasympathetic division, which is the brake, which controls you when your body's at rest. And so researchers said, God, if there's some way we can talk to that part of your brain, we can get a lot of information about overall how well you're functioning, and number two, how stressed is your body. So then the question became, well, how do you talk to that part of your brain? Well, somebody made a brilliant observation. When you study cardiac function, when you study the heart is an intriguing organ on a multitude of different levels. But what makes it so interesting is that your heart literally has its own brain. It has its own electrical system. It has its own pacemaker. It beats on its own. So what's the relationship between your brain and your heart? Well, your autonomic nervous system, this unconscious part of your brain, which controls all of your basic function, controls the rhythm of your heartbeat, the gas pedal and the brake. So researchers found you can see how stressed you are or how well you're working by measuring the rhythm of your heartbeat when you're laying down, when you stand up, when you do this maneuver called the Valsalva maneuver, which you just create some pressure, and then you do some relaxation breathing. And these are really important functional tests because they give us a direction. Once we know where you are, we can then compare you to yourself to see if your body's getting better or worse or staying the same. So that's the basis of functional medicine. So you can, the next slide. So at this point, you know, if you guys have any questions, I'm certainly free to and here to answer anything that you might want me to answer.
Yeah, but if you guys have any questions at all, feel free to write it in the chat box or the Q&A box, or you could actually raise your hand and we'll allow you to speak. I'm also going to go ahead and put all of Dr. Bloom's information in the chat box, so you guys can feel free to reach out to him. I'll give them a moment, but that was really great. I learned a lot.
Great. I had no idea what I said, but thank you.
No, it was terrific.
Anyone have questions?
Let's see. think people are being shy.
Okay. Maybe either I explain things so well that they don't really need, to ask any questions, or I completely confused everybody and they have no idea what I just talked about. I would probably go with the latter.
But if you do have questions, you should reach out to Dr. Bloom, either email him, maybe he can give you a quick email or a quick consultation back as complimentary for joining on tonight, and then see if it's a good fit and see how he can help you. And his email and phone number, Corinne, will be posted, correct?
Yep, I'm doing it right now. I'm writing it in the chat box.
Great.
All right, we have some questions here. First one. What is generally indicated by an oral yeast problem and cause?
What is generally indicated by it?
Mm-hmm.
Well,
Probably looking
again,
for treatment.
I'm sorry?
Probably a treatment for oral yeast.
I didn't hear you. I didn't hear you.
Probably a treatment for yeast. What
Right.
would you recommend?
What would I recommend? Well, yeast feed off of sugars, so don't eat things that feed them. If you don't feed them, they won't grow. And then there are a lot of different ways of treating, as you know, there are a lot of different ways of treating bacterial or fungal infections. There's plant-based products that you can use. Berberine is one that comes to mind that's used as an antibacterial, antifungal agent. There's also medications that you can use. You probably recommend some of those, Phil.
We recommend a lot of diet because you're right, Bruce. Sugar is like, I tell people, it's like lighter fluid for yeast. So we try and recommend like a South Beach type diet.
Right.
Cut out the bread, the pasta, the sugars, the alcohols. Try it for 10 days. Anybody can do anything for 10 days.
Right.
Try and tell people do it for a month, they roll their eyes and you've lost them.
Yeah, you're right. You're absolutely right. But
Probiotics.
one of the things that, one of the conversations that I very often have with people is, again, when you see evidence of the problem, the evidence is not the problem. So let's try to figure out what it is that's pissing off your body, what it is that is making your body unhappy. And the same thing that may make my body unhappy may not make your body unhappy. There are kids who can, jump into a jar of peanut butter, lick their way out, and they're perfectly fine. There's another kid, you say the word peanut butter to, and he goes into anaphylactic shock, right? So, the challenge that the healthcare system has is trying to personalize and individualize it, which is something that you've done a great job over the years with.
Oh, thanks. I think personalized medicine, that approach is really the key to people's health. Not fitting a round peg in a square hole. And with all the autoimmune issues and differences today, I think it's the wave of the future.
We use words. Yeah. We use words that confuse people. Like, so instead of saying you have a fatty liver, why don't you just say you have a clogged filter? It makes it a lot easier to understand. Instead of saying you have an autoimmune condition, why don't you just say you have a pissed off immune system? Because if you have a pissed off immune system, your natural nature is to say, okay, well, what do you think is pissing it off, right? What is making my immune system angry? At a conference on autoimmunity, I probably heard one of the best lines I've heard in 40 years of being in functional medicine, and that is, to understand, autoimmunity or immune system function, you understand a very simple concept. Good fences make good neighbors, right? Keep things out that hurt the immune system. When particles and debris get through, your immune system is going to engage them. And not every immune system can engage every particle and debris as good as somebody else's, right?
We have another question coming from Cheryl now. She said, thank you so much for the great overview. Are there any general supplements you would recommend?
Yeah, yes and no. I mean, I think that, for immune system function, there's obvious things like, vitamin C, and there's zinc, and there's vitamin E, there's a lot of different nutrients that do help support the immune system. I'm a big fan of recent studies on plants, plants are a lot more intelligent than anybody ever gave them credit for. You know, plants are living organisms that are rooted into the ground and can't run away from danger. So for them to survive, they have to make families of compounds that protect themselves from whatever the environment throws at them, whether it's sunlight or bacteria or funguses or viruses or whatever, drought, you know, so plants make these families of compounds called phytochemicals. And now we're starting to understand them. We're starting to understand that these chemicals can actually influence our physiology very dramatically. There are certain families of phytochemicals that actually help damper and regulate the inflammatory response. There are certain phytochemicals that you can use that can kill bacteria and funguses and yeast. There are certain phytochemical families that can help your liver detoxify and clear stuff out. There are certain phytochemical families that can help your body react better to sugar, and so it can process sugar more effectively. So, you know, everything is really customized. You know, it's really a customized plan.
Okay. Great. All right. Does anybody have any more questions?
And tell Cheryl I say hi.
Well, if there are no other questions, I want to thank everybody for joining us tonight. We're going to be sending out notification in April. We're going to have a Dr. Isadora Guggenheim speaking on ozone therapy for us. And you guys can join us there. If you'd like a recording of tonight's lecture by Dr. Bloom, please sign up for our newsletter and it'll be posted on our YouTube channel on our website within the next 48 hours or so. And I want to thank everybody for joining us tonight in our new way of getting the word out. Thank you, and we'll speak to you soon.